Patients ask us, are there any symptoms that they should look out for with regard to colon cancer screening or colon cancer evaluations? And that's correct. What they should wonder, or what they should look for example, are one, if someone has had rectal bleeding. Many patients think that rectal bleeding is just from hemorrhoids. That's not the case. We see patients all the time who have had rectal bleeding, and even people who are sure that they have hemorrhoids or some type of an anal fissure, and it turns out that it's something more significant, a colon polyp, a colitis perhaps, which is an inflammation of the colon, or even colon cancer. So it's very important to let your doctor know when you have bleeding, and perhaps to push the subject a bit and make sure that that colon is checked carefully. So bleeding is very important. The next thing would be a change in bowel habits. By that we mean if someone normally has, for example, slight constipation. Constipation is very common, but then they change and all of a sudden the bowels are a little bit more loose. Or perhaps they have perfectly normal bowel habits, and then the bowel habits change and they're perhaps a little bit of diarrhea, a little bit of constipation, and that has not been their habit in the past. That should prompt some type of an evaluation. Certainly if someone is going through their life and things are going well and they notice they're starting to lose weight. Losing weight is something that we all would like to do. However, if it starts to come a little bit easier than someone is used to, and if someone has lost 10 pounds or more, that's an indication to be evaluated as well. Those would be the three main things that I would look for.